Article that came out on wberg.org. I will leave a link to this article in the description box. And this is going over, and you're going to probably see a lot more articles like this cropping up in the very near future because these drug addicts, these opioid, heroin, fentanyl addicts, are now the biggest drag financially on the economy. Now, these caucasoids will try to talk about welfare, which most of them are on, but it's not welfare, ladies and gentlemen. It's this drug plague that is a complete drag on society. And this article really gets into the heart of what is happening that the mainstream media will never tell you. Okay, so let's just get into this article. Billions of dollars lost to the opioid plague in Massachusetts. And we know this is not the only thing that's dragging them down. When you really think about it, the suicides and all of the autopsies that got to be done, that's racking up billions too. There are many ways to measure the devastating impact of opioid addiction in Massachusetts. Rising numbers of babies born addicted to heroin, and that's a really good point. I was reading the heroin addicted babies are the most expensive to treat in the hospital because they have to ultimately stay longer in the hospital than any other baby. And he said, even if the baby is addicted to any other drug, it does not have to stay in the hospital as long as the heroin opioid addicted babies. So it drives the cost of the hospital bill even more. And many of these addicts, these pregnant addicts, they don't have any money, ladies and gentlemen. Many of them don't even have jobs. So, who's footing the bill? I know that's a question they love to ask when it comes down to black people. More emergency room visits and hospital stays, parks littered with needles, and roughly 6 people who stop breathing during an overdose every day. So this is what's going on in Massachusetts as well as across the country. But there's been little attention so far to what the plague is costing the state. That may be in part because there are few, if any, state-specific estimates of the plague's impact on 4 main areas: healthcare, lost productivity, criminal justice, and deaths. But a breakdown of the semial estimate from the Centers for Disease Control, CDC, suggests that states' economic burden was about $10 billion in 2016. That's a lot of money. That's a lot of money to treat people that don't even want to stop doing drugs. For those lost to opioids, there's an additional cost based on the value of life that one economic model also put at 10 billion in the same year. The CDC found that opioid use, dependence, and overdoses cost the US, listen to this amount, 78.5 billion in 2013. Y'all better not ever come back to black people about no damn welfare. Okay? You better not ever come back to us about it. Most of these addicts are caucasoids. And that's why y'all keep running and ducking and dodging the issue, because this is impacting your people. That's a big number, but almost certainly underestimate current costs for two reasons. First, because opioid deaths have risen dramatically since 2013. Second, because 78.5 billion figure is based solely on the cost of addiction to prescription opioids. That's right, they're not even talking about the street drug. It does not include costs tied to heroin or fentanyl. The latter has become the leading cause of death. In Ohio, Massachusetts, and other states, the CDC is in the process of updating its economic burden assessment to reflect more recent addiction and overdose data, taking into account losses associated with street drugs. With those two combined, I would expect the number to be larger because it's covering a larger range of potential problems, said Curtis Florence, lead health economist at the National Center for Injury Prevention and Control at the CDC. In 2013, Massachusetts had 2.2% of prescription overdose deaths, according to the CDC. So Massachusetts' share, the 78.5 billion figure, could be in the range of 1.7 billion. Since then, overdose deaths in the state have risen more than sixfold. Oh my God, that is outrageous. Sixfold? Totaling 1990. So the economic burden today is likely increased to at least 10 billion. That's still almost certainly a lowball estimate because it does not factor in deaths from heroin or fentanyl. And see, this is why, this is a good example to why will probably never get the true numbers of how bad this addiction is. They are lowballing the number because they don't really want you to see what's happening. Remember, these people that are the keepers of the numbers are the biggest deceivers on the planet. They're not going to ever tell you the truth. You know, when I hear that term lowball, it makes me think of the 13% they keep insisting black people are in this country. And we know they're full of shit. Been saying that mess almost for centuries. In addition, a new analysis suggests the opioid plague is taking a bigger bite out of labor productivity than previously projected. Last year, Princeton University economist Alan Kruger published research that found almost half of prime working age American men who've dropped out of the workforce take daily pain medication. In other words, they're junkies. For about 2/3 of them, it's a prescription. Kruger added another layer to that finding this fall in a paper published by Brookings with funding from the Federal Reserve Bank of Boston. And Kruger links counties with the highest rate of men out of the workforce to those with the highest rates of opioid prescriptions. Remember, the highest unemployed now are white males between the age of 20 and 54 that are not in the labor force and they're addicted to drugs. And that goes back to the deaths of despair. Okay, over the last 15 years, the spread of prescription opioid medication could account for possibly 20% of the decline in labor force participation, Kruger said. He has not calculated the cost of this decline, but it does seem to having a major economic effect on the US economy. Kruger said, no, it's having a major effect. See, this is why Donald Trump will not sign that national emergency. He's looking at these numbers and saying, we can't do this. We're already pouring billions into this drug addiction. If I sign this declaration, then it's going to break the economy. It is. See, it's a reason why, come on, it's a reason why they've declared this a national emergency. And it's well over a month later, and he hasn't signed anything. Because the numbers right now and helping all these addicts around the country don't look good. Now, if he signs that as a national emergency and we have more disasters, that's going to really cripple America. And you got to understand, what are you pouring all these funds into? You're pouring funds into people that are going to ultimately stay on drugs and keep dragging down the economy? It's not worth it. He has not calculated the cost of this decline, but it seems to be having a major microeconomic effect on the U.S. economy, Kruger said. Massachusetts does not have any counties with the highest overlap between opioid prescribing and a shrinking workforce. Neighboring New Hampshire and Maine do, but the prescription rates still have increased considerably in Massachusetts, and it's still substantially higher than was the case 10 or 15 years ago, Kruger said. State leaders say it's important to understand all ways of the opioid plague takes a toll. But the big cost is the price that individuals and families pay and the number of lives that have been lost over the course of the last decade, said Governor Charlie Baker. This is a model some economists use for calculating that loss. It's called the value of a statistical life. It's used to weigh the pros and cons of raising the speed limit, for example, or changing pollution control rules. The value ranges from 4 million to more than 7 million. Harvard Medical School Associate Professor Anupam Jena suggests using this model to evaluate the cost of overdose deaths in Massachusetts. If you multiply 5 million by 2,000, which is the approximate estimate number of lives lost to an overdose in 2016, you get 10 billion. If you look further back to 2010 to 2016, that number is about 40 billion, Jenna said. Wow. That's all I got to say is wow. All I got to say is wow. Woo, there is nothing that's dragging the American economy down more than this drug addiction. You know, the black on black crime defense is just becoming stupid. Okay, black on black crime is not costing no damn $40 billion in a year. He suggests that these steep tallies should guide spending on addiction prevention programs, treatment, and other ways to reduce opioid overdose deaths. But let me just tell you something, ladies and gentlemen. Trump already said that declaration is for fighting drugs on the street level. That emergency declaration will not go towards any treatment programs at all. So ultimately, it's not going to help these drug addicts at all. Okay, let's get back into the article. Because if the cost to the state of Massachusetts per year is 10 billion of lost welfare, 10 billion of lost happiness, and then the state should be willing to spend 10 billion or more to combat the plague, Jenna said. That's where that number really becomes relevant. While these are sobering numbers, they still do not reflect the total economic toll of the opioid plague in Massachusetts. What about the children? Said Dr. Laura Burke, an emergency room physician at Beth Israel Deaconess Medical Center. Burke says seeing children come in to visit parents after an overdose or hearing stories of children finding a parent passed out, perhaps dead, have become common. She wonders how much the opioid plague will cost the next generation who may deal with post-traumatic stress disorder, depress, uh, uh, depression, and other physical health problems. Well, if they have post-traumatic stress disorder, then where's the rest of their family members if the parents can't step up to the plate? And that's what's getting me. There are so many white children in foster care now. They're outnumbering all other children that's in there. And I have to wonder, you all try to put on a front like you're so united. How come y'all ain't stepping up for your own children that are sitting in foster cares all around the country? And you can see the articles are all out there about the foster care system just loaded with white children and babies. Okay. One county in Ohio told Reuters its child services budget has nearly doubled in 5 years as children of parents addicted to opioids flood the system. See? A bad childhood has major ramifications, Burke says. It worries me to think about what these children will deal with and the impact on society. They'll probably be drug addicts too, just like their mommy and daddies. Ladies and gentlemen, tell me what you think. This is deep. I mean, you're talking about one state. Now, picture of all 50 states in America all going through this addiction, because there's no state that's not impacted by this. Every single one is. Please tell me what you think. Please leave your comment and subscribe. And if you can donate to my channel, please do. Peace, family.